Hello everyone, I'm Dr. A, dentist by profession, starting this video series called Dental Awareness to Promote Dental Health. This platform is to enhance your dental knowledge, where together we will learn about basics of teeth, right techniques, various dental terms which is used by the dentist and it is written in the prescription which you have no idea about it, various dental setups, equipments and many more. Main aim is to be more vigilant about various dental problems and how can we prevent it from happening in the first place. As we all know, prevention is better than cure. Okay, so let's start. Today's topic is dental awareness to promote dental health. Okay, so when a dentist say oral cavity, it means oral is your mouth and cavity is inside your mouth, your tongue, your teeth, your gums and many more structure inside your mouth. From now onwards, when a dentist say in oral cavity you have so problem, he or she means your mouth. You have so problem in your mouth. Okay, now that we know what is an oral cavity, let's find out what we have in oral cavity. Now in adults we have 32 teeth and in kids we have 20 teeth. So remember you all, 32 in adults and 20 teeth in kids. It's very important. Now when a dentist say Mr. XYZ, you require a root canal treatment in this tooth, that means he or she is talking about one single tooth. Now when dentists say Mr. XYZ, you require a root canal treatment in number this teeth, that means he or she is talking about more than one tooth. So remember, tooth stands for one, teeth stands for more than one. Okay, let's divide the whole mouth in 4 quadrants or sides. Each quadrant have 8 teeth. Now let's name all the 8 teeth. Hello teeth, what are your names? So the names are incisors, some say incisors. So let's go for incisors. Then we have canine, then we have premolars and molars. We have 2 incisor, one in the center is your central incisor and on the side of it is lateral incisor. To remember, lateral incisor is a brother of central incisor. And if you can see the sharp tooth, that's your canine. Yeah. In adults, we have 2 premolars and 3 molars. Remember, premolar stands for just before molar. Okay, if you can see very closely that premolars are very small, just looking like molars. So that's why they are premolars. And then we have 3 molars. First premolar, second premolar, then we have first molar, second molar, third molar in adults. So remember, in adults we have 2 incisors, central incisor, his brother lateral incisor, then we have a sharp tooth called canine. After that we have 2 premolars. Why premolars? Because they are lying before molars. First premolar and second premolar. Then we have 3 molars. First molar, second molar and third molar. Remember, that makes 8 teeth on each side in adults. Whereas in kids, we have 5 teeth on each side. There is no premolar, no third molar. So that makes 2 incisors, central incisors, lateral incisors, 1 canine, and 2 molars, first molar and second molar. So it's very important. Remember guys, in adults, 8 teeth on each side. That means we have 4 sides. So 4 multiplied by 8 equals to 32 teeth in adults. Whereas in kids, we have 5 teeth on each side. That means 5 multiplied by 4, that equals 20 teeth in kids. Remember, it's very, very important. Next is the quadrant. So we have divided our mouth in 4 quadrants: 1, 2, 3, and 4. So we go clockwise: 1, 2, 3, and 4. Okay, so this helps dentist in numbering each tooth and identifying it. So if you see in the photograph that if dentist is talking about anterior teeth, you have so problem in your anterior teeth or in your front tooth, your front teeth, he or she clearly talking about central incisors, lateral incisor, and canine only. Anterior meaning first 3. Okay, when they say about posterior or back tooth, that means they are talking about the 2 premolars and 3 molars, or any one of the premolars or the molars. So remember, anterior, posterior. Anterior means front, posterior means back. Okay, so the upper bone is your maxillar bone and the lower bone is your mandible bone. So teeth originating from the upper bone is your maxillary teeth and lower is your mandibular teeth. Now if you open up your dental prescription, you will see certain numbers and you have no idea what those numbers are. Okay, so I'll tell you. Now we dentists, we divide our mouth in 4 quadrants, like first, second, third, and fourth. Then we number each tooth. For example, first is your central incisor, second is your lateral incisor, third is your canine, fourth is your first premolar, 5 is your second premolar, 6 is your first molar, 7 second molar, 8 third molar. Similarly on the second side, that is on the second quadrant, 1, 2, 3, and so on. Similarly on the third quadrant. Similarly on the fourth quadrant. Now what is the significance of all this? Now if you see your dental prescription clearly, it might be written some number. Now for example, like advise for RCT or a restoration, or you require a cap, and you don't understand which tooth is the dentist talking about. So now it'll be easy for you to understand. The 4 is your fourth quadrant. First is always the quadrant, fourth quadrant, and the other 4 is your fourth number tooth. And which is your fourth number tooth? It's your first premolar. So remember, dentist is talking about there's a problem in your fourth number tooth in your fourth quadrant. That means lower right first premolar. Fourth quadrant, 4 number tooth. Remember. That means you require a root canal in lower right first premolar. It's very important. Remember, you guys, because you should be aware of what is happening in my mouth, which tooth the dentist is working on what the dentist is talking about. Now there's one more example. If dentists have written this way, there's this diagram, and then it's written advise, for example, root canal again, because it's easier to correlate, and then it's written followed by maybe crown or cap. Then what does that mean? It means, if you see the above diagram, the second quadrant, it's written on the second quadrant. Which number written? 4. That means in the second quadrant the dentist is talking about number 4 tooth, and in the lower one, it's the fourth quadrant, 6 number tooth. Okay, so I'll repeat it again. First quadrant, second quadrant, third quadrant, and fourth quadrant. So the dentist is talking about second quadrant, 4 number tooth. So the 4 number tooth is first premolar, and in the fourth quadrant he is talking about 6 number tooth, that is your first molar. Okay. Now, for example, your dentist write down advise extraction 1, 8 and 3, 8. So what does 1, 8 stands? 1 stands for the first quadrant, and 8 is your third molar. Similarly, 3, 8 is written. That means that's your third quadrant, and 8 is your third molar. Simple, right? So this all happens in case of adults. This numbering system all happens in case of adults. End of the video. Let's talk about the component of the tooth. What does a tooth stands for? We should know this. The inside, this red one, is your pulp. The yellow one is the dentine. And the white one is enamel. Remember, a tooth is composed of enamel, dentine, and pulp. Enamel is your white one, red one is your pulp, and the yellow one is your dentine. This is what your tooth is composed of. And this is your crown part, which is above your gums, and below your gums is your root. Above your gums is your crown, and below is your root. Enamel is the white one, which is the outermost layer of a tooth, which you can see in any individual. Just smile in front of mirror and you'll see that white thing. That's your enamel. Inside that is your second layer, that's your dentine, and inside that is your pulp. Okay. The tooth portion which is visible, that is your crown portion, and which is not visible, which is inside your gums, is your root portion. So when dentists say you have a problem in your crown or your crown is broken, that means the dentist is talking about the section which is above your gums. So this yellow is your dentine. Dentine is usually yellow in color. The red is your pulp. It consists of blood vessels. And this pink one is your gums, which surrounds your tooth. If you smile in front of mirror right now, you will see the tooth and the gums. but dentists do not call it gums. Now, if you hear dentists saying that your gingiva is receding, what does that mean? You might have heard dentists saying that, or your dentist might have told you that your gingiva is receding. That means gingiva stands for your gums. So that's your dentine, pulp, and this is your outermost layer, enamel. So dentists call gums as your gingiva. For any query, please feel free to message me directly. Stay tuned for my next video, which I'll be posting it soon. So tell me if there's any query or anything. Thank you so much.